Health officials now use the term long haulers to describe people who are now living with new conditions or ongoing symptoms. Local 4's Michaela Hughes-Shaw reports it's not clear why it doesn't happen to everyone who catches the coronavirus.
It's been nearly 2 months since Jocelyn Meyer from Clinton caught COVID.
I woke up in the middle of the night and was extraordinarily nauseous and had the body aches and had a fever.
One scary symptom was spells of high blood pressure that landed her in the ER.
That was scary because that high blood pressure can cause things like a stroke.
And the symptoms didn't stop there.
I was experiencing anxiety, which, that would make sense, right? You have a virus, it's a pandemic, it's scary.
High blood pressure, mental stress, confusion, and fatigue are things she is still dealing with today.
I'm still taking medicine for it, which I've never had to do in my life. So really for me, I'm not fully recovered.
Researchers are calling people like Meyer long haulers, dealing with long-lasting symptoms like shortness of breath, lack of energy, and body aches. Research has shown that about 10% of COVID survivors will experience some of these after effects, but experts say there's still a lot more to learn.
We don't fully understand why this occurs in some patients.
Jennifer Caudle says they are still learning about who will be impacted most.
Patients who have ended up being long haulers have been young people, older people, people with underlying medical conditions, some people without any underlying medical conditions.
Which is why she says stopping the spread is important.
And it really underscores the importance of why prevention is so important.
Michaela Hughes-Shaw, Local 4 News.
There are ongoing studies for long haulers across the country. Online support groups are available for people who are struggling with it. We have that information for you on ourquadcities.com.
Thanks so much for watching this video. I really hope it's helpful. I'm Dr. Jen Caudle. I'm a practicing family physician, an on-air health expert, and a video creator. And I was the one that was commenting in this video about COVID long haulers. As a practicing family physician, I can't tell you how scary these symptoms are to me and my colleagues and the many patients who suffer from them. The truth is, we don't entirely understand why, COVID seems to leave lasting symptoms with some people who get the disease. It's one of the things that really makes this condition even more mysterious than it already has been. And it's one of the reasons why I'm such an advocate for mask wearing, social distancing, staying away from groups that are not your own, hand washing, all that good stuff. It's not just about getting COVID and not having symptoms, maybe being asymptomatic, but it's about those people who say go on to be hospitalized and potentially dying, but also those people such as long haulers who may have COVID and recover, but still tend to have lingering symptoms that we don't fully understand. So I guess my points are this, there's so much that we still have yet to understand and learn about COVID. The good thing is that there is research being done about COVID long haulers, which makes me feel really good. There are institutions that are studying long haulers. There are centers for long haulers. There are also things like Facebook support groups and other things. If you think you're a long hauler or you know someone who is, make sure that you're talking to your doctor or having your friend or family member do the same to make sure that they get the proper treatment that they need. But the best thing that we can do is honestly prevent the transmission of COVID in the first place, to reduce the risk of anyone getting the disease, to reduce the risk of someone getting it and then becoming a long hauler. That's wearing your mask, social distancing, staying out of groups, not traveling, etc. And remember, the COVID vaccine is one of the best things that we have to fight this disease. So when it's your turn, make sure you get the vaccine if you're eligible. Guys, I'm Dr. Jen Caudle. Thanks so much for joining me. If you've not subscribed to my channel, I invite you to do so and click the little bell for updates. I'm doing videos daily on COVID and so many other health topics. You don't want to miss them. Please consider joining my subscription groups. I have YouTube subscription groups. You get extra perks, benefits, merch discounts, and all sorts of stuff. Guys, I'm Dr. Jen. I'll be back soon.